What is PGTA? PGTA stands for Pre-Implantation Genetic Testing for Aneuploidy. So the first question you probably have is, what is aneuploidy? Aneuploidy is when there's an abnormal number of chromosomes within the embryo. Why do we care? We care because usually when there's an abnormal number of chromosomes, it results in an embryo that's either going to fail to implant or fail to develop properly, and it usually ends in an early miscarriage. So if we can screen away the embryos that have abnormal chromosome numbers before we get to the transfer stage, we hopefully can improve the chances of success when it comes to having a live baby. And one of the things we do know is that aneuploidy within a woman's eggs increases with age. So that means as women get older, the number of eggs that are aneuploidy increases. On average, when you're 35, for the average woman, it's a pretty normal number, but then it gets worse exponentially as women get older, to the point where women who are 45, it's estimated that 95 to 98% of their eggs could be aneuploid. So that's why we want to look at aneuploidy in embryos. It's also important to note that aneuploidy in embryos could come from the egg. It could also come from the sperm, or it could come from a division within the embryo after fertilization has occurred. So there's many causes of aneuploidy. So there could be multiple different ways aneuploidy arises. The most common way we think is through the age of the egg, the woman at retrieval. So when we get an embryo that has the correct chromosome copy numbers, we call that embryo euploid. And that's a great place to start. But it's important to note that just because you get a euploid embryo and transfer a euploid embryo, it does not guarantee you're going to have a healthy baby. It just puts you on the right path. There are still many factors that can affect implementation or fetal development that need to go right to have the healthy baby. In addition, even if you PGT test your embryos, you should always follow your OB's guide when it comes to genetic testing, prenatal genetic testing throughout the course of your pregnancy.